Now, the issue of long COVID and several cases of post-COVID complications are being reported in Delhi, with people complaining of high fever. Doctors say they are handling at least 30 patients with post-COVID complications a day. Sukirti reports.
A never-ending fight against COVID, it seems. Many of those who have caught COVID in the second wave are now returning to hospitals. In Delhi, doctors are now handling 25 to 30 post-COVID patients in their OPDs every day. And it's no longer just fatigue and lethargy. Patients need oxygen support even several weeks after discharge.
I think 70% or the 80% of the patients that we're seeing in the outpatient department these days are the post-COVID patients only. Basically, when we see lung fibrosis is known to occur in people who are elders, above 65 years of age. But this time, because the disease affected a lot of these middle-aged people also, starting from 30 onwards, plus in fact some children as well.
Fever is a common symptom during COVID, but doctors say even a month after recovery, patients are reporting high fever.
What we are finding this time is we are finding even inflammation post-COVID, or what we call as long COVID, but I am seeing a lot of secondary infections as well, which include, obviously, as we have heard, mucormycosis is one of them, but we are seeing lung fungal infections. I have seen infections because of something called nocardia, which is an opportunistic infection.
For some, the post-COVID symptoms are so severe that they have to be admitted in ICU again.
Few patients are coming with gangrene of their digits or of their gut, or secondary complications like ruptured liver abscess.
Delhi has now come out of the worst phase of the COVID crisis, with daily cases declining to less than 500. But many of those who caught the infection back then are likely to continue the battle against its after effects. In New Delhi with camera person Sushil Rathi, this is Sukirti Dwivedi for NDTV.